Hi, everyone. How are you? Good to see you.
Best overlooked non-mainstream artists of yesterday and today.
Good to see you too. It's good to see you too. Thanks everyone for joining. The focus is going to be COVID-19 for this press conference. I don't have a lot of updates myself.
What's going on?
I don't know. I keep muting them and then they appear again. It's exciting. We are up to 8,213 cases since the start of the pandemic and 156 fatalities. We have a lot of information to share about vaccines, so I'm just going to go right over to Director Bond to share that information.
Okay, great. Good afternoon. I'm just going to share some slides so that I can help make this process a little better for people to visually see what the updates are. I thought that I would start with a quick situational awareness. As of today, the city of New Haven are seeing for our 14-day case rate about 49 cases per 100,000. As you know, the Connecticut is still primarily in the red. We continue to work closely with the state on monitoring our cases and also responding to the pandemic and ensuring that access to testing as well as the vaccine rollout are working smoothly. This is just a comparison of the different cities within the state. The primary urban cities, one of the things that we also assess is how are we comparing with other cities within Connecticut, just to ensure that we are closely monitoring our sister cities. And so this is just a case comparison within the 5 top cities. We continue to monitor and look at county indicators as another factor. And so we look to see how we're doing on a county base. And so currently, as you can see, we're still seeing through our primary and secondary indicators that we're still seeing some high risk categories and are closely monitoring that and hoping that after the holiday, we start seeing a downward trend around that. The good news that we're seeing currently is that we are seeing that a number of beds for COVID cases are going down. And so we are happy to see that there is capacity within our hospitalizations. That's one of the recent studies through REACH indicates that hospitalizations is a great indicator when looking and assessing our reopening factors, especially among schools. And so we are happy to report that within Yale New Haven system, we are not seeing any concerns at this time. One of the things that we've been really working and focusing on is supporting and administering within phase 1A. We have vaccinated from the health departments and healthcare workers, as well as those first medical responders that qualified under first 1A. We vaccinated over 2,100 to date since our rollout on December 28th. Our supporting partners have also provided vaccination rollouts, and we continue to convene as a logistic group to look at the different phases. We're now gearing up for phase 1B. As you know, the phases are approved through the governor's immunization advisory group. And so we know that through phase 1B, those that are individuals 75 years of age and older will be able to make appointments directly with their medical providers and get vaccinated. I'll talk a little bit about other alternative options as well. We all know that CDC issued new guidance as well, and hopefully we will see an update from the state relatively soon. We always want to align our efforts around what's happening on a national basis and national recommendations. And so we will closely continue to monitor that. And as you know, things continue to evolve. We know that frontline essential workers will be under phase 1B, which is going to expand the number of individuals that in the pool of those that are eligible to be vaccinated. And so we are working through that to ensure that we are conducting specific outreach through the different frontline essential workers category. Those in congregate settings and members within that will also be defined, but we are knowing we have a better picture of what those are, and we'll be working with those partners to ensure that they're enrolling and uploading rosters of those individuals as well. As always, we want to make sure that people understand that vaccine is free of cost. No one should be asking for your social security number. One of the things that was recently announced that there was some potential scams out there asking for more than just your insurance card. And so just please be mindful that no one should ever be asking for your social security number when being asked to be vaccinated. Vaccines are it's not deemed on your citizen status, and so we ask that and we encourage everyone that's eligible, especially our frontline workers, to please work with your employers to get vaccinated. Registration, again, as mentioned, is going to be multifold, so that we can ensure that we are meeting the needs of the different types of enrollment. And so those that are over 75, again, should contact their primary care doctor, can also enroll through the VM system, and that's on the portal ct.gov. They can be able to contact 211, and then they will be able to also assist with the 877-918-224. And this will go live as of tomorrow, the 14th. We are looking forward and are actively trying to engage different methods of communication to the public. And so we are doing that through our social media, mass emails with licensed food establishments, working with those registered businesses, partnering with economic development, doing mass emails and direct outreach for our senior housing facilities. And then also we will be doing direct community through our different wards and doing outreach directly to the communities so that everyone is aware of the different opportunities that are now available to them. And so just to talk a little bit about our messaging and our materials, we've been really heavily focused on making sure that we are keeping health literacy in mind. We have developed our materials in Spanish, Mandarin, and Arabic at this time, and are doing mass printing and mass emails, and also distributing these materials to our different partners to share and be able to post. This is just an example of our different marketing efforts and our different risk communication materials that we have developed. We want to make sure that people are being informed. So we, in addition to all of these materials, we are also working on developing webinars for the different phases and the different groups that are sectors, so that we can make sure that we provide timely information. It continues to evolve, so we want to make sure that our partners have the necessary information to be able to enroll and get individuals into getting vaccinated. This is just an example of our Spanish materials, and we're very proud of our team and our risk communication committee, our community stakeholders, who all provide input to all of the development of our efforts. We also as you know, just completed and are finalizing phase 1A, but we would just want to encourage phase 1A eligible individuals to please register and sign up before we transition into phase 1B. We're anticipating that we start rolling out into phase 1B in the next week. And so we want to make sure that we really target those and continue to provide support to our healthcare workers and our first responders. We will be targeting high-risk populations and will continue within the phases, and are looking forward to working closely with our Yale New Haven Hospital, our community health centers, Yale New Haven Health, and our state to be able to work collectively on effectively ensuring that access to vaccine is not an issue in our city. This is an example of the VAS enrollment, just quickly. This is what this is how individuals and organizations can use to enroll. And so we ask you to please take note of the VAMS enrollment web link. These slides will be made available after this press conference, so that we can also post it on our website. But this is just the enrollment process. It is simple to use. You will register your employer information, for example. You will then upload your roster. And then once you upload your roster, each of your employees will receive an email, and they can then register and make an appointment at a location that is most convenient to them. There's multiple sites that will be available within the system. Individuals that are over 75 and eligible will also be able to do the same. And those that are not able to have access to the internet will be able to make appointments with 211 and the 877 number that I just previously shared. I do want to emphasize after vaccination, before I close, that protection to vaccine is not immediate. We ask that individuals follow the emergency use authorization approval from FDA and still follow the 1 to 2 weeks, follow the 2-dose series. We know that to be fully vaccinated, we want to be able to have several weeks after the second dose. Vaccine is not 100% effective. We are happy to see that Moderna just recently announced that Moderna does provide protective factors for up to a year. So we were happy to see that the recent news, but we still know that herd immunity is going to take a long journey. We need the large vast of the population to be vaccinated. So we still ask people to follow the precautions, to be vigilant and still wearing a mask and wearing it correctly. Not being in social gathering, making sure that you have 6 feet away from others, avoid any type of crowds, and washing your hands often, and continue to follow the CDC travel guidance. We've seen a significant number of individuals traveling, especially during our recent contact tracing efforts. So we advise you to please follow the CDC travel guidance that has been issued and follow the quarantine procedures, because we know that if you get tested, and prematurely, you will not have the protective factors that you need. And so we ask individuals to please follow those, as well as any workplace or school guidance from the district. And so with that, I just want to turn it back over to the mayor. Thank you so much.
Thanks, Director Bond. That was a lot to digest. I'm going to open up to questions in just a minute or two. I did want to encourage folks that, given the fact that the number of people that need to be vaccinated is incredible, that it will be quite some time before we're able to vaccinate a lot of people. And it's important that people still get tested on a regular basis, whether they're symptomatic or not. And we have a lot of capacity to get tested, particularly the site on Sargent Drive. Engage, if you have the flyer up there that you can put up there. There's a lot of capacity for people to get tested. It's fast, and people can usually get through there in just 10, 15 minutes. It's important that people get tested for all the reasons that we've been saying over months and months. So we hope people use that resource. There's been a lot of changing gears here. There's been a lot of questions that we've had about public safety, given the turmoil that we've seen in Washington and the Capitol, and some of the information coming out about potentially targeting state capitals. And so I wanted to have Chief Reyes share what we're thinking about this on our end, to make sure that our residents understand that we're prioritizing keeping folks safe and monitoring this situation very closely. Chief.
Thank you, Mayor. Good afternoon, everyone. Yes, as the mayor said, as many of you are, we are monitoring and have been monitoring just the dynamic and the events that have played out ever since the incident on January 6th at the Capitol. We have been in close communication with our federal partners, particularly in the last few days, making sure that we have every piece of information necessary to keep our city safe and to be able to make the decisions necessary to proactively keep our city safe. We had a meeting as recently as today. The mayor and I did with the ASAC of the FBI New Haven office, just to, again, make sure that we are communicating, that we are opening the lines of communication with other city partners. Many of our city partners were on the call. Tomorrow, we will have an operational meeting with many of our law enforcement partners around the state, and certainly in the local region, just to align our efforts to make sure that we have open lines of communication. What I do want to make sure I emphasize is that there's much information coming down, much of it law enforcement sensitive, that I can't share. But what I can tell you is that there are no known or credible threats to our area. The FBI, as recently as today, has confirmed that they've received no information suggesting any threats to our region, especially not New Haven. As the mayor mentioned, there are threats or there are calls for protests in state capitals. So our counterparts at the state, we've been in contact with them, obviously are preparing for the possibility that they could have some civil unrest and that there could be protests and escalating threats in our state capital. However, as of right now, there are no known threats or anything of concern, just again, the information that there's a call for protests at all the capitals of every state. Just wanted to make sure that we opened and availed ourselves to you, the press, so make sure that we're communicating with our citizens. Obviously, they are monitoring the events too. There's a great degree of concern about what these potential threats can mean for our region, and we want to make sure we allay those concerns by communicating with them effectively in a timely fashion and making sure that they know that we're doing everything possible on our end to learn from what happened in DC, and also to make sure that our communication is as up to date as possible so that we can keep our city safe, and we're doing just that.
Thanks, Chief. And of course, in addition to monitoring the situation, even though we haven't seen anything concrete as of yet, the chief and his team and our local partners will be prepared for any issue that may arise. As we know, the situation is somewhat volatile, and we'll be prepared should something come up.
Absolutely.
Why don't I open it up to questions? And I saw Ed Stannard had his hand up first.
Thank you, Mayor. I just actually raised my hand for a small question. Maritza went out for a brief second when she was talking about how many have been vaccinated to date. Was that 2,100 people, you said?
Yeah, the health department, that doesn't include what our local partners have vaccinated to date.
Okay. That was as of yesterday, right?
Correct.
Thank you.
That's all you needed, Ed?
For now, yeah.
Okay. We can come back to you later.
Thanks.
Go ahead, Tom.
Thank you very much.
Of
For
course.
Director Bond, could you break down that 2,100 number for us a little bit? How many of those are city employees? How many firefighters versus nurses versus other healthcare workers?
That's been the question and the challenge within our department, because we're utilizing a federal link. And so when people are uploading their rosters, it gets vetted and approved through that roster. And so we do not have the ability to break it down by job title. And so we are working through trying to address that glitch currently. But we're sort of our hands are just a little bit tied with the current output that this current system is able to allow us to do. I mean, we've even contacted the state and we haven't been able to rectify the issue just yet.
Yeah, I could add to that.
So it's a
because
combination.
This is a point of frustration. We're both we both give the vaccine to other people that are in currently 1A, and we are an employer that uploads our rosters so our employees can get vaccinated. And unfortunately, we don't have data either as the employer or as the health department as to demographic information of who is getting vaccinated, race, ethnicity, age, address, region, where people are employed, what type of employment people might have. We don't have that information, both of whether our own employees have gotten vaccinated or our residents have gotten vaccinated. And I've personally shared my strong interest in making sure that we have the data within HIPAA guidelines, of course, because that helps guide our ability to respond with education, to ensure that there's not a population that is being lost or forgotten, or it also helps us understand whether there's hesitancy around vaccinations from any certain population. The state has expressed a interest in making sure that the VAM system is capable of sharing that information. But to date, we do not have the ability to get that information.
Thank you.
Yeah.
Have all of the vaccinations given out to date by the health department been at the Meadow Street Clinic?
Yes.
And when do you anticipate opening other vaccination sites around the city? Would that start with phase 1B?
Correct. And so when phase 1B rolls out, we will transition. We are meeting with our vaccine partners because we want to do this in partnership with our vaccine partners, and we will be convening with them by the end of this week so that we can execute a plan that's going to then activate one of our sites. And we will also be doing specific strike teams so that we can accommodate specific communities. So more details to come.
Thank you. And then one last question, if I may, about phase 1B. So those who are eligible are people 75 and older, frontline essential workers, and those in congregate settings. Is that correct so far?
Correct. However, we do know that the governor so far, but there was also, it's going to be fluid because we know that there were some recommendations for individuals with additional 2 or more comorbidities and or those who are over 75. The CDC then just mixed in the new recommendations and guidance. So I do know that the governor's Connecticut immunization advisory group were reconvening, and there's going to probably be some changes with phase 1B. So we will see what that is once we get the update. So it's a little fluid right now, but for that's the current update that we have right now.
There's discussions around 65 and older instead of 75 and older, but there's not yet clarity on that. And again, we don't make this decision, the state does.
And for those who know that they're eligible right now, can they register now, or do they have to wait until January 18th before they can register to set up a vaccination appointment?
We encourage those that are 75 and over to start contacting their provider now so they can start identifying whether their provider actually has the vaccine. The phone systems will go live as of tomorrow, and they'll be able to start making their appointments.
And that's true for the other groups too, frontline essential. They can start calling tomorrow to schedule an appointment.
75 and over is really the target for tomorrow.
Thank you.
Thanks, Tom. I'm going in the order that I saw folks raise their hand. I think I saw Dave next.
Thanks, Mayor. A couple of quick questions. First, we're hearing around the state, a lot of people have they feel like the vaccine rollout is coming in slowly. So how has New Haven been with receiving their vaccines? Currently, do you feel like you have enough?
Do you want to take that?
I'm sorry. Yeah, I didn't hear the question because it looked like my internet was frozen. What was the question, Dave?
Sure. It was, how do you feel the rollout of the vaccine has been in New Haven? Do you feel like you have enough supply right now for 1A?
Yeah, I think the vaccine rollout has definitely been interesting for certain. We know that we're one of the Connecticut is one of the leading vaccinators in the country, right? And so we're limited to the supply from the federal level to the state level, and then the state level is trying to figure out an equitable way to distribute to the different cities and towns. So for me, under phase 1A, we had a high demand. We definitely ran out of vaccines last week. However, we do know that there's other multifaceted factors happening. And so we've just been patient and supportive of the vaccine rollout and where we are given the circumstances with the state. And so if they call us and tell us they have extra vaccines, we immediately take that on. However, we also reduce the number of clinics to be able to ensure that we're not overextending, because we do want to make sure that we're being mindful of capacity. So we'll scale up when it's necessary, but we also scale down when we need to, just to make sure that we are basically working with the state as they roll out the vaccines. And it's a week-to-week situation at this juncture. We order vaccines on a Wednesday, and then we're informed when what we've been approved, and by Monday we'll get another shipment. And so we're working closely with the state on that.
Short answer, Dave, is no, we don't have enough vaccines to put.
All right, so with that in mind,
Dramatic.
with that in mind, are you guys, I mean, 1B looks like a really large group of the population. I mean, I feel like by the time 1B is done, we're gonna have a large percentage of people vaccinated. Do you feel like we're going to run into some issues with rolling out a vaccine with that many people on top of 1A already?
So this is what we know. I had a conversation with the state at 8 o'clock this morning. We know that there's going to be an inauguration next week. There's going to be a new administration coming in, and we're expecting masses of vaccines to be released. And so we need to plan for it. So we will be planning accordingly. That's why we prioritize to meet with our partners, because we want to make sure that we know that we are in this together. The health department is definitely not the answer to mass vaccination, and we need to execute collectively so that we can get as many people vaccinated. And we're looking forward to getting some more clear directions from the federal level down to the state levels so that we can then implement it at the local level.
In terms of phase 1A, I know you gave the numbers, but what percentage of people in the population of 1A have been vaccinated? Do you roughly know?
You know, I actually don't have that number for you. I can definitely get that for you from the state level.
And then lastly, for me, these vaccinations, if people who are going to sign up, do they have to be a resident of New Haven in order to get it from here? Or could you be a part of the neighboring suburbs and be able to register and come here and get it?
That's the luxury of the VAN system, is once you enroll and you are activated in the system, you can pick, you can type in your zip code where you reside, and then you can indicate to the system how far you're willing to travel. And all those clinic sites will then populate for the individual. And I think that's phenomenal because it doesn't pinpoint or does any bottlenecking of requiring people to do it where they reside. They can do it where they work. So people have options.
Okay, great. Thank you, guys.
Thanks, Dave. Kyle.
Hi, everyone. So for the public vaccination option for 75 and up, Director Bond posted that website link for people to register. Do they have to be approved through the VAM system, or is this a whole new section of the website to allow people, individuals who aren't working or retired, to register?
It's going to be individuals that are going to be putting their date of birth. So they do have to be 75. If it changes to 65, then the system will then vet that date of birth. They have to certify on the website that they are testing that that's their date of birth, and then it needs to be verified at the vaccine site.
Gotcha. Okay, so no worries about approvals and uploading for that part.
Yep.
And then for Chief Reyes, I do have two questions, and perhaps Director Bond might know the first one. When will the police begin to get vaccinated for, I understand they are supposed to be in phase 1B.
Well, it's a combination of the two. Some of them already started getting vaccinated because they fell into the category of phase 1A. And then we would just continue with them at phase 1B, as well as frontline municipal workers that need to get the vaccine under phase 1B. And in addition, making sure that we continue with healthcare workers that didn't fall into phase 1A, but fall into phase 1B. So it was just sort of, it'll be a continuum in addition to 1B.
Okay. So some police officers have been vaccinated, but they'll sort of phase into this phase 1B starting Monday.
Yes, and we are very fortunate. We already have their roster ready to go.
Gotcha. And then my last question for Chief Reyes is, and this is a little bit more about what you were speaking to. I just wanted to double check with you or ask you, are you guys concerned at all or looking into whether or not any employees might have been at the Capitol? We're just seeing some other reports from around the country of other law enforcement agencies checking to see if any of their employees were in DC. Is that a concern for you guys?
Well, I can tell you that as of this point, we have not been informed by any of the investigative agencies. The FBI is working, as a matter of fact, has really activated many of its departments to put all hands on deck on this investigation to expedite and get information as quickly as possible, but also to expedite the investigation. We have not heard at all We are not concerned about that. We are concerned about, we saw some of the dynamics that played out. We need to assure the public that the New Haven Police Department and its officers are prepared to do their jobs professionally and to answer the call when the time comes. We saw, again, some of the dynamics, a lot of it having to do with officers being, again, not well prepared in terms of the planning, but also some of the officers sympathizing with some of the protesters. We understand that. And so much of what we're doing is making sure that there's internal communication, but also across other cities as well, that we're talking to our officers and making sure we have a game plan so that everyone knows what's expected of them. We have not heard, in short, that any of our officers traveled. And if that information does come forth, and we'll address that accordingly.
Sounds good. I think that's it for me. Thank you.
Thanks, Kyle. Ed, did you have a new hand up, or is that your old hand that's up?
A new hand. It's my other
All right.
hand.
All right.
I was just wondering a couple of things about the vaccinations. Frontline workers who are part of 1B, Maritza, could you, I don't know, maybe it's in the PowerPoint, but could you say who that includes?
So employers on that qualify on the frontline workers will, right now, what we've been informed are definitely early education, education from K to 12 workers, transit, grocery, utility, food and agriculture, sanitation, public works, and public health workers. And so it's a vast number of individuals, and employers will be responsible for enrolling. They are not, and then they will enroll a roster. And so that's how individuals within those specific sectors will be eligible to schedule an appointment.
Are these mostly public sector workers or private as well? Education,
This is
I
a
imagine, might be
combination of
private.
well, grocery is public, right?
Grocery.
Private. Yeah.
Right.
So there's private, retail, food. And so there's a combination of the two. So there's definitely, and it's on the PowerPoint, some examples of what is under phase 1B.
Okay, and the other question I had was, when will you start giving the second dose to the people who got the first in phase 1A? That start soon or no? And do you have the vaccinations in the freezer?
We do have vaccines on hand, and we will be allocating specific clinic sites, and we'll be activating our clinics accordingly. So we will be providing outreach to those communities so that we can, we activate and promote our clinic through the system. So as individuals are enrolled into the system, they will be able to book their appointments through the VAMS system directly.
Okay. Do you know when that starts? Do you know, I guess 3 weeks from when 3 or 4 weeks from the first?
Phase 1B is pretty much starting now. So those that are over
Talking about
75.
the second shot. The second
Yeah.
shot.
Oh,
for an
the
individual.
second dose. I'm sorry, I didn't hear the second dose thing. You cut off. No, second dose is an automatic enrollment. So we do have those on hand. We have to keep those on hand. So we did receive our first shipment of second doses, so that those individuals that received the first doses are then automatically enrolled to make an appointment. So that's actually alerted through the VAM system as well.
Okay. And will that be like in the next week or two, do you think? Or?
Yeah, 28 days after our December 28th. So, you know, some of us will be getting vaccinated around that time.
Okay, great. So that's the Moderna vaccine then, because it's 28 days?
We've just given the Moderna vaccine at this time, correct?
Thank you.
No, you're
Tom
welcome.
and Dave, I'm going to go to Emily and then go back to you guys just to kind of mix it up a little bit here.
Hey guys, how's it going?
Good, how are you?
Good. Director Vaughn, I just had a quick question for you. Obviously, the allocation subcommittee yesterday recommended expanding phase 1B. It'd be about 1.5 million residents. What are your thoughts on that proposed expansion? Is that a good move for the state, or is that something that will cause a little bit too much chaos?
Well, you know, for us, we really want to try to make sure that as we roll out phase 1B, that we're definitely working together, those vaccine providers, and understanding what capacity each vaccine provider has, because it can get disjointed really quickly. So, you know, it's going to be key. And that's why we have a vaccine logistics team now, because we want to make sure that that does not happen in our city as much as possible, that we're really having an organized way of executing this vaccine, because at this juncture, we know that the more people we vaccinate, it's a good and bad problem, because the more people we vaccinate, we can get to herd immunity, but we can't get there. We want to try to get there fast, but we also want to do it in an organized manner. So it's good that we want to expand phase 1B, but we also need to be looking closely on our capacities and how do we then streamline that with our respective partners.
I'd like to add to that. You know, people sign up, and so I'm not sure as it's likely we'll have chaos. The thing that we've talked a lot about is a concern that people may not know how to sign up, that employers that may be smaller and not have the knowledge, not have the language ability, VAMS is not Spanish, for example, may have under the table or undocumented employees, may not sign up for VAMS. And we want to make sure that if there's a increasing number of people in the pool in 1B, that it's not everyone that is well put together or has an employee that's well put together that is first in line for this, and that populations that may not have the kind of resources have to wait for weeks and weeks to get the vaccine just because of situations that are out of their control. And that's why I think this data is very important to us in understanding how the vaccination rollout is going and who is getting access to it, and more importantly, who is not.
Yeah, and I think just to wrap up that question, Emily, it's really for us, equity and access is really critical, and we need to make sure that the vaccine gets to those that are mostly impacted to begin with, communities that have been mostly impacted. And that's what and I think that's the frustration that the mayor is expressing, is he's been asking me for data for 2 weeks, and I'm like, you know, it's really hard when you don't control the data from the federal side, because then it doesn't allow us to export. Like our nice fancy dashboard that you all get to see during our press conference, we own that data, right? So then we can manipulate it and be able to demonstrate exactly what we want to share with all of you. We're not able to do that with the federal website. And so that's what we're trying to address. So our concerns is definitely different about where we are with the implementation of the distribution of equity and access.
And you talked earlier about verifying people's age for the first phase or the first wave of phase 1B. As we move into more groups becoming eligible in phase 1B, do you have a sense of how that verification will work? I'm thinking particularly of frontline essential workers, and then also of people with comorbid conditions, if that group is added to phase 1B.
So as each of the phases are expanded, what happens is that there's a couple of factors. Number one, they're entering into the system, so they need to be vetted and approved into the system when they're enrolling. So they are testing and acknowledging specific questions within the system. When they come on site to a specific vaccination site, there's posters on the eligibility of that phase 1B, and then the people have to self-certify that they are indeed adhering to that particular phase that they're getting vaccinated under. And so there's two verification process, I should say. So it's through the system and VAMS primarily, and then secondary when they come to the site to get vaccinated, when they're self-certifying and getting their information verified.
Just one last follow-up question on that. Specifically when it comes to people with comorbid conditions, how does that verification work? And to tie us back into equity, I assume that if somebody has a documented medical history, it's a little bit easier, but what about people who maybe don't have their own medical records or haven't been to see a doctor in quite some time?
So because that has not been officially announced as a phase 1B, we have not been given clear directives of how we're going to be verifying that specific population. So once the state really issues that verification process, then we'll roll out at the local level.
Okay, fair enough. Thank you, guys.
Thanks, Emily.
But that's a good question.
Let's go back to Tom.
Thank you. I'll be quick. How many total doses of the vaccine has the city received from the state so far?
So we received right now we have I don't have the total in front of me, but we administered 2,190. We have 1,000 on hand because that's for the second doses. And I believe, and we have about 600 or so doses for the rest of this week. But don't quote me on that because I need to verify that with my clinic nurse. But
Thank
I
you.
can get you the exact number if you really need to, like, just so that you can have
Just
the
again,
actual
since
fact.
the 2190 sounds very specific, I just want to know out of how many doses, how many have been used.
And the 2190 is from December 28th
Mhm.
to
Uh,
date.
And then quickly, just Mayor, since we are on a press conference and this just happened, the House of Representatives just impeached Donald Trump again. And I wonder what you make of it.
I think it was the right call. I think we have to call out the kind of rhetoric undermining of our nation's history of following the rule of law, and make a strong statement that what happened at the Capitol is totally unacceptable. Anything else, Tom? Dave?
Tom took my question there at the end, but the only other one I had is for education. I know you mentioned K through 12. Does higher education, do colleges count towards this 1B?
Not to my knowledge at this time. There's different, however, there's different college medical students and health profession students that were eligible under phase 1A. And the expansion to higher education, I do not have any updates at this time.
All right, that's it for me.
Thanks, Dave. Emily, are you back? Or is that your old hand?
That is my old hand. Sorry about that.
No problem. All right, any other questions before we go? Great. Thanks, everyone. Good to see you.
Stay safe.